We're going to get started here, and we are going to talk about senior challenges. And my special guest is Koshi Thomas, who is the publisher and the chief executive officer of Voice of Asia, which has been in circulation for more than 27 years, and he's also the publisher of Healthline Magazine.com. And so let's talk about Koshi. Welcome. Hold on, I need to get your microphone. That's right. Let me see if I can. Sorry about that. Let's see if you get your microphone hooked up. Okay, test.
Good morning.
A little bit louder.
Good morning.
Okay, all right. Koshi Thomas, welcome to Nik Nikam Network Talk Show. We are on 1050 KCHN. If any one of you would like to join in the conversation, the number to call here is 281-745-4161. Okay, yeah, let's talk about let's give us a little bit about your background. I mean, everybody in Houston knows about you, but still, for the benefit of those listeners who are going to be listening for the first time, or those who are going to watch this interview on YouTube, let's give you a background, and then we'll move to the senior challenges.
Good morning, everybody. I thank Dr. Nikam for inviting me to this special feature story, and he asked me about my background. I'm not a doctor, I'm not a nurse, I'm not a physician, but I am just an ordinary person who came in the early 70s with the family. And that is probably, when I talk about the seniors, it is partly my story also.
Oh, yes, yes.
My story also. Of course, thank God that I am doing well.
Yeah.
But nothing to complain except the age-old weakness we have. Everybody has it. That's all I have to say. Actually, for the last 10 years, I was closely watching the plight of the community who came in the early 60s and 70s.
Yes, yes.
When I say the seniors, I mean those people who came in the 60s as students, from the 70s as professionals. I also came in the professional category because of my wife, who survived a cultural shock, hard weather conditions. I think for me, I had to go through two financial meltdowns of the country.
I see,
I think most of them went through that one
true,
also. Fought bad weather, worked hard, raised great kids, children, lived rich, retired rich, but never anticipated the struggle of being a senior.
That's fascinating. And, I have given lectures about the stress of retirement to the physicians, and I have seen it firsthand because as a cardiologist, most of my patients are in the senior citizen category, and we're going to touch upon a lot of these different aspects which are of very great importance, especially because we are the first, we were the first generation Indians who came here, and we are also turning out to be the first generation Indian seniors and Desi seniors, I should say. It applies to all those from Pakistan, Bangladesh, Sri Lanka, Nepal, and all these other places. So let's explore some of these things. Ladies and gentlemen, if you would like to join in the conversation, the number to call here is 281-745-4161, and you're listening to 1050 KCHN Houston, Texas. I am Dr. Nik Nikam, and you can also listen to us on KCHNradio.com. Okay, Koshi, let's start off with what are some of the most significant things that you have come across, not only personally, but also because you interact with a lot of other senior citizens in the community, from a Desi seniors from the Desi seniors point of view.
Actually, Doctor, thank you for bringing that issue, because that is my concern also. It is for me, when it comes, it's very emotional in that issue, because I have seen some of my friends, or family friends, or community friends, who had the same lifestyle, lifestyle and retired rate, and what they are facing now is so many kind of sickness which they never anticipated.
Yes.
There are not one issue, not if it's a house.
Yes.
like the roaches in the house. Everybody, at least one person in the house has some sort of disability or problem in the house.
Isn't it strange? Because I'm also getting there, and I mean, every time I turn around, something is hurting, you know. Anything that moves hurts, and anything that doesn't move doesn't work.
It is the standard of every person after a certain age, because I go through that struggles every day. What I believe is people live in a state of denial, so that they don't admit they have that problem. They always pretend that I am fine, my family is fine, but probably issue is you. But that is not the situation. My idea is we have to come out from the comfort zone we are enjoying it, and then try to find out what is going on wrong with the community and try to help. Because I have seen some other community who seriously involved in this.
You're absolutely right. If you look at the mainstream American population, they have so many avenues for senior citizens to, one, physically and mentally and emotionally, spiritually engaged. And we have a lot of these things as far as spiritual and cultural events are concerned, but from a physical and from a personal point of view, I think we are just beginning to understand the magnitude of this problem.
Yes, that is exactly what I wanted to tell the people. Because this is knowing all these things. Actually, for the last 10 years, as I said, I was emotionally searching for what to do.
What to do?
I cannot treat a person.
I know.
I cannot go and say something because I don't have the authority to say something. But whatever I can do is what I did now. I published a magazine called Healthline. Healthline. It is published. It has actually greatly appreciated by all the medical professors, medical people, professions, I say, and the readers. So I'm really encouraged to continue that business. What they do is, we are trying to get information, articles. By the professional doctors, probably sometimes with the alternate medicine people. How you can treat, how you can maintain it, how you can prevent it. That's what actually the magazine is all about.
That's fascinating. You're doing this great offshoot from your Voice of Asia, because I've been a cardiologist for 35 years, and as I said, most of the people I see are like past 65 or more. But now more than ever, I am paying attention to all of their life aspects besides their heart problem, high blood pressure, and kidney problem. Now I said, okay, what is your biggest concern? He said, oh, Monday I'm going for CAT scan, Tuesday I'm going for MRI, Thursday I have to see a urologist, and Friday I have to see a dermatologist. It looks like more than half of their life is spent in just circling doctors' offices.
It is not only circling, because we miss the schedules also, because there are so many things to go. Other than that, the family is involved in it. Retirement is retirement. Sometimes people think, oh, it's a great blessing, but I have experienced with people. They all say, please don't retire, because it's a hell of a life. Because after a few weeks, they started sitting at home and complaining. I have pain here. I have pain here. Trying to actually.
Well, I have seen a couple who say they started getting into fight because there's nothing else left to do.
Nothing else left to do, because looking at the same face morning to evening, sitting there, and it leads to some kind of irritation up there.
I have given seminars on the stress of retirement, and there we say some things like, when you're in a real profession, you're traveling at 600 miles per hour for 30 years. Now, all of a sudden, you stop the plane or the journey, we don't know what to do with our lives. So unless we seriously prepare for, there you got your call. Unless we seriously prepare as to what we want to do with our life, When people think they are retiring from their job, they think it's a total retirement, but in reality it is not. You're just retiring from your job, but you still have to address your physical life, your emotional life, your psychological life, your spiritual life, and time, which is the biggest challenge for people. Maybe we can highlight on some of these
Actually,
things.
whenever we have all financial planning up there,
Yes.
retirement plan up there, but nobody is talking about the stress which you are going to have after retirement. That's where actually professionals like you
Yeah.
or the community has to come together. Even I will suggest to have an event which is going to have a real research in this one.
Absolutely, yes.
What these people are going through. Because there is emotional, physical.
Sure.
Even the houses we built early when we came here,
Yeah.
the houses are made for comforts.
I know. They're not meant for
Not
convenience.
meant for wheelchair.
Yeah.
So actually that's also is a big issue now. Most of the people live in two-story houses.
Yes.
Good cars. Even the car itself is a burden.
Oh, yes.
House is a burden. Getting out of the bed is a burden. Getting back to the bed is a burden.
I was just thinking, sometimes we don't understand. A lot of our Indian people, they stay with their children, then transportation becomes a major issue if they don't drive.
When you talk about the children actually it's a big asset.
Yes.
But we don't have the joint family system what we enjoyed back in India.
India, yes.
We just brushed it out.
Yeah.
Because why it is done, maybe it's because of the financial safety we have it here.
Yeah.
Anyway, that is not happening. Their wisdom, their life experience is still sitting there and rotting because they cannot, there is
Yeah.
nobody to hear that one. Probably that is another area we have to explore. Joint family living may not be easy because everybody works.
Yeah.
Children have to go to school. All this burden is loaded back to the parents who are retired.
Any type of minor physical disability becomes a whole family problem for the children and the caretakers.
That's what I was just going to say. Any handicap in the house is everybody's handicap.
I know this.
Because I know, I was my own experience. I was born to a blind father.
Yeah. So that rubs on every member in the family.
It everything because
It's
if you want to
affected.
go out, somebody has to follow him.
Yeah.
To food, everything they need help. The same way, if you are not have the mobility, you are stuck there.
Yeah.
That is what many of the families. When nobody say, oh, my dad has Alzheimer's. Nobody say that that other diseases. Everybody keep quiet. Oh, then only thing is you won't see them again in the public.
I know.
They are limited to the four walls of the room. But that is where I thought this magazine will help. They can read it. They can probably seek help. Go to the doctor. Do most of the things they can do themselves. So my feeling is if I appeal to the people, read it, and make suggestions for that one. That can help the thousands and thousands of people.
Absolutely. Let's take a little break here and we'll come back and we'll continue with our discussion on senior challenges faced by the Desi community.